Hi classmates, today I will be doing my client case presentation on a client that I worked with last year in my first year practicum. I just started my second year practicum last week, so I haven't had any interactions with clients. So please keep in mind that the assessment that I will be reading off basically comes from reports that I received from social worker and all parties involved. I will also be posting the genogram, ecomap, and timeline in the files along with the details of this assessment because I'm not sure if I can get all the information in 7 minutes. I will also be changing the name to the client just to keep his identity safe. Okay, I will be starting out with stating that his name is Timothy Jones. He is a 4-year-old African American boy. He currently lives with his foster mom, or his foster parents, and his twin sister. They live in Tracy, California. According to notes from social worker and Timothy's foster mom, child has been in and out of foster care since 0 to 2 months old. Timothy has had multiple homes. He has lived in 6 to 8 different homes since removal from his biological parents. Per foster mom, she is currently working on permanent adoption. Prior to foster mom, the client resides in a foster home in which he stayed there for about 2 weeks. Due to a child's problematic behaviors, the foster parents could not handle him, so they opt out of providing him care. In 2015, client was living with his aunt and uncle, in which CPS was called due to a large amount of exposure to abuse and domestic violence. The child suffered from physical abuse. He was getting shoved by his uncle, and his uncle actually shoved his face in the toilet. He also suffered from physical abuse by getting hit with the hangers. He suffered from verbal abuse, and he did not receive adequate nutrition care. Per social worker's report, there is no known medical diagnostics at the moment. Timothy, at the time of my practicum, received one-on-one therapy with the Child Abuse Prevention Council with the outpatient program once a week, and he received additional therapy 2 to 3 times a week with a different agency. He also receives behavior modification services inside of the classroom. That was actually my job. I assist with providing him with positive praises, modeling positive behavior, teaching him about respecting personal boundaries and personal space. According to child's therapist, child has a difficult time verbally expressing himself, and she would like to see him be more confident in his feelings. He seems to be a follower and not a leader per his therapist, so she would like for him to work on those. Because the client is too young to diagnose, hypothetically speaking, if child was of age to diagnose, I would suggest that he definitely went through childhood trauma. He has anxiety and PTSD. According to the social worker's report, client's biological mother is addicted to drugs and alcohol, which she used while she was pregnant with client. Per social worker, client is bipolar, and she's bipolar. She has depression and schizophrenia. Along with child's biological dad, he abused drugs. Biological mother was also involved in prostitution. Per social worker's report, client has 2 older siblings aside from his twin sister. Both of the older siblings have ADHD and they are taking medication. Per foster mom, when client misbehaved, a foster mom attempts to tell client that's not okay to misbehave. Child becomes fearful, then states, "I see him coming," or talks about dark figures coming after him. Per foster mom, when child states the above line, child says his uncle's name. For example, "Bob is coming after me." The name of the uncle was changed. Per foster mom, she believes that the child has PTSD from previous foster family. Per foster mom and social worker's report, when a child is upset, he will throw himself on the ground and hit himself on the head, He attempts to pull out his hair. Also, when he's upset, he breaks anything around him. Client has fearful memories of being abused. For example, if foster mom attempts to close the door, client will throw a tantrum and scream as long as he can until the foster mom opens the door. Per student's interaction and interventions with the client has many strengths in the classroom. He's very helpful and he appears to have a very positive attitude. He's very eager to learn. He is very eager to assist teachers and friends. Per foster mom, child is very loving and grew attachment to foster mom. However, the client faces many challenges such as following directions. The client has difficult time with personal boundaries. Per observation, client's twin sister does not respect client's personal boundaries in which the client does not verbally express. According to the social worker and foster mom, client's twin sister seems to be the leader of the two. Client likes to copy her, everything that she does, and if she does do anything to him, he pretty much allows it. Twin sister actually touches client in private areas. However, her social worker and foster mom, they are working with her to talk about personal boundaries and how she needs to respect that. It seems like the client is adjusting to his surroundings pretty well per social worker and foster mom. I think he's having a difficult time going to school for about 7 hours instead of 4 hours. They had to switch his schedule around. So presenting issues is the client has problematic behaviors, especially with aggression, following directions, personal boundaries again, and verbal expressions. So I have a lot more, so you guys can please definitely take a look at my assessment for more details, and thank you so much.